Okay. Good morning, everybody. My name is David Fear with Shepler and Fear General Agency up in Roseville, California. I want to thank those who are attending this meeting. We're supposed to have around a dozen people or so attending the meeting, so we'll give everybody a minute or two to get ready for that. And doing the presenting today is David Slepak. David, you're down in Phoenix, Arizona. Is that correct?
That's correct.
Well, grateful to have you on the call today. And I think you've got control of the presentation at this point, so I'm going to turn it over to you and let things go. And we're going to try to do this in about 30 minutes or so, and hopefully we'll have a little bit of time for questions at the end of the presentation. Is that all right, David?
Fantastic. Sounds good to me.
Okay. Very good.
Can everyone see my screen there? Should have the building there with Redirect, Shepler and Fear General Agency Group Healthcare Solutions.
Yep.
Awesome. So this is very interactive. Like Dave mentioned, I want to be very mindful of your time. However, I want to make sure that we address any top of mind questions, and of course, we're always available after the session to connect, to further the conversation. And I have plenty of time blocked out. So thank you again for allowing me to share with you Redirect Health. I'm actually broadcasting live from our headquarters here in Scottsdale, Arizona, and that's our building here, right north of the runway. So our agenda today, a little bit about Redirect Health, some healthcare facts, our solution everyday care, a little bit about some step-up items, Choice and Choice Plus, our premium plans, how to sell in your agency and broker, and then some support and next steps. That's me. I'm David. I've been in the healthcare biz for quite some time. I actually cut my teeth in insurance, in a captive solution in P&C. However, I quickly learned that a passion for healthcare, and I support our general agents and brokers nationally. So I do quite a bit of traveling. However, I have an unbelievable support team here to help in every way possible to support our brokers nationwide. A little bit about Redirect Health. We've been in business for over 20 years. We approach this from a very unique angle. We've been a provider running multidisciplinary primary care clinics here in the Phoenix metropolitan area. Currently, we own 7 clinics throughout Arizona. Last year, we saw over 200,000 visits. So that's kind of where we view the world, or at least kind of how we've thought about healthcare. And you'll see kind of how we built our plans, and we'll go into a little bit more detailed information on that. Currently, we have active groups in 40 states, and we've been expanding year over year. We have about 250 employees supporting our members nationwide. We're on pace to be in all 50 states by 2018, and we've been recognized as a leader in healthcare innovation. I'm going to give you a little background of the premise and kind of the opportunity of where we play really well. So this is what we know today. About 51% of working Americans make less than $15 an hour. This includes industries like construction, hospitality, franchise, food service, agriculture, home health care, senior care. This is according to the Social Security Administration. These are places that Redirect Health plays extremely well. We also know that in 2016, the average premium price per employee was over $6,400 per year. These costs continue to rise. This is nothing new to anyone on the call, I'm sure. It's just the premiums on major medical just keep going up. Here's some other interesting information with regards to premiums and worker contributions. You can see premium increases about 58% from 2016 or 2006 to 2016, and worker contributions almost 80% increase over the last 10 years. So obviously there's a significant amount of cost shifting because these are not keeping pace at an equal number. This slide kind of shows the trend going towards high deductible plans. Again, it's continuing to accelerate at a super high rate. The challenges are when you're dealing with folks that are making $15 an hour or less, these high deductible plans become more and more unattractive, and quite frankly, the wrong solution for those types of people because they can't afford, you know, the first $2,000 bucks, let alone $6,000. Again, some more supporting facts on the increasing use of high deductible plans or HSA qualified high deductible plans. So kind of to summarize kind of the state of the union here on healthcare as we see it, is over half the population in the U.S. earn $15 an hour or less. Premiums, again, are rising at an alarming rate. Employers continue to pass on higher percentage of those increases to employees. Deductibles and max out-of-pockets are not only rising, but high deductible plans are becoming the norm. And we see employers starting to really shift away from traditional PPO-type plans. So increased premiums, degradation of benefits, cost shifting to employees have really resulted in a declining participation. So in 2016, according to the U.S. Department of Labor, the average participation for an employer-sponsored plan was only about 52%. What we know today is the industries that we serve very well, construction, hospitality, those industries that include franchises, food service, home health care, that number is dramatically higher. So we only see maybe 20% or 30% participating, with sometimes 60, 70, 80% not participating on the plan or the sponsored healthcare plan. So let's quickly talk about, and again, this is kind of all background information so you can kind of understand where we're coming from and where we see our product fitting well into your book of business. So common benefit design for an employer, the top-down approach. You start with your major medical plan, and then you try and pull all sorts of levers to push that plan down to middle income and your low-wage workforce. You're making the deductibles higher. You're making the network more narrow. It's a hard task as a broker to make a major medical plan accessible to all employees within the group. It's just tough. And again, as those plans continue to rise in price, it's exponentially more difficult to get them down to that low-wage workforce because you just run out of runway, right? You run out of levers to pull to make that thing happen. Where we've built our product suite and where we see it fitting extremely well is what we call the participation pyramid or the bottom-up approach. And where we find the greatest success is when our agents and brokers address a low-wage workforce with a product that's designed specifically for them. An affordable first dollar benefit type of plan that's very affordable. Then you can start to add the insurance products that are needed in addition to that plan for the category and really the assets that need to be protected. So when you do this, we see participation increase by 20, 30, even 50% within a group, and that has all sorts of implications to your clients and their employees that you serve. So declining participation affects a lot of things, and it makes our jobs much, much more difficult. For your clients, recruitment, retention of employees. People aren't participating on the plan or, it's unaffordable. People leave to go find an affordable plan. When you're able to recruit people on an affordable health care plan, you can staff, in super tight labor market. Low morale, unhealthy workforce. Workers' comp premiums tend to rise when there's lower participation within a group. There's all sorts of case studies that show a direct relationship between low participation on a healthcare plan and workers' comp premiums. For us as advisors, it limits options for benefit design and carrier options when you have low participation. It affects your ability to provide valuable ancillary benefits like dental, vision, CI, when there's no medical attachment. Very few people buy, an accident policy if they really don't have core healthcare benefits. Of course, it affects your compensation, and at the end of the day, it kind of puts you at risk as the source of poor benefits if you're offering poor benefits, and that makes you very vulnerable for the guy or gal that comes in that shows them nice benefits or thinks that they can get better benefits. So we've built a very mindful solution to that core medical plan. We call it everyday care, okay? And just to kind of outline here, we're going to go through a couple different products. Stop me along the way if you have any questions. Again, I want this to be very interactive. So everyday care is an ERISA level-funded first dollar benefit health insurance plan with a very comprehensive benefit structure. Everyday care premiums start at $105 per employee per month, and it includes fixed costs and claims funding. Okay, so fixed costs is aggregate insurance, EPA administration, comp, and a redirect health administrative fee. And claim funding, just like any other self-funded account or self-funded plan, goes into the claims bucket. This plan is funded at max claims, or $30. The actuaries have said that they expect $24, and actually this plan is running about $17-18 today. Okay, there is a return of surplus, a return of premium on the surplus on the account at $5, $10, and $15 per employee per month. It's a 4-tier pricing schematic, and we'll kind of go into that as well as we get further down the road. So here are some really important facts. These are differentiators of everyday care in the marketplace. So there's no participation requirements on this product. We can write it down to 2 lives. There's no contribution requirements, so it can be completely voluntary or 100% employer paid or anything in between. It's guaranteed issue, so there's no underwriting, no medical questions. Fixed pricing, so it's $105 for an employee, $200 for an employee spouse, $200 for employee children, and $300 for a family. Everyday care is ACA compliant and meets minimum essential coverage requirements. So this gets your employer out of the A penalty, also the individual mandate as well. This can be written in all 50 states, and it's available to full-time, part-time, seasonal, and 1099s. Another beautiful part about this product is we can do what's called an easy census enrollment, and we'll go into a little bit more detail on that further in the presentation. So this product is extremely easy to sell, extremely easy to enroll, and very, very comprehensive. We'll go into a little bit about kind of the rules of the road in California as to how this product works, specific to stop loss, and kind of the size groups that you need to be thinking about when enrolling this product. Okay, so any questions right now on how everyday care, this foundational core product, is built? Denise, Rose, Scott, feel free to unmute your mics. Happy to answer any questions. So if there's no questions on how the product is built and kind of the facts along everyday care, let's talk about how the product works. And again, as we go through this, I want you to think about all the things we've built into everyday care and subsequently how it would affect a major medical product if we were to add specialists and hospitalization to this product, okay? So about 10 years ago, within our own company, we stumbled upon this concept of self-funding. And what we learned is that if we could control our claims costs, those were our own dollars, and subsequently we'd get those back at the end of the year. So we established this little team within our own organization called Care Logistics. And the Care Logistics team would be the central point for all care within our own employees. So during the recession, we had other business owners, friends of the co-founders, say, hey, I'm getting killed on on healthcare costs. Things are out of control. Please help us. So we said, hey, just call our care logistics team and we'll try and help you be mindful of your healthcare dollars. And we started to do this for free for other people within the community that our co-founders knew. About 4 years ago, we said, gosh, this is an actual business, and ultimately Redirect Health was born. And today, our care logistics team, located here in Scottsdale, serve hundreds and hundreds and hundreds of employers all around the country. So this care logistics team provides what we call continuity of care. 24 hours a day, 7 days a week, 365 days a year in English and Spanish. And all of the education around our products, our program, our onboarding, our member communications is about calling that 888 number that you see on the left-hand side of your screen. And when you call that number, in fact, you need to call that number for anything related to your healthcare plan. Our team is able to do lots of different things, and we call that continuity of care. Okay? At the end of the presentation, I'm sure Dave and his team will send out the kind of benefit summary sheet, but we'll start with what this plan includes and how it works. So our team provides 5 essential functions that are delivered right over the phone. The first one is care management of chronic and acute disease. So imagine if you had diabetes, COPD, any sort of asthma, on pain medication for any reason. Our care logistics team will provide our members with care management and a population health. So every employer and employee is assigned a case manager that's going to help those employees manage those chronic and acute diseases. And what we found is most of these folks making 8, 10, 12 bucks an hour, they've never had anything like this before. It's a very mindful way to help these people, especially in a demographic that has been historically underserved. The next thing that our care logistics team does, again, right over the phone, is 24/7 care logistics support and scheduling. Imagine you have a cold. You're able to call into a number, escalate that call to one of our providers, includes nurse practitioners, board-certified MDs, as well as a medical director. These are all employed Redirect Health people sitting right here in Scottsdale, Arizona, and they would be able to diagnose, create a care plan, and even prescribe right over the phone. We're able to do this, again, 24 hours a day, and we become the first stopping point or the first place where members can potentially receive care. About 70 to 80% of the time, the phone call stops right there. We've been able to service our member, provide care, but what if we can't? What if we need to listen to heart and lungs? What if we need immunizations? What if we need a physical or something that we can't do over the phone? That's where telemedicine, kind of drops off, right? What happens when you need the in-person? Well, if an in-person visit is needed, we have physician-to-physician case management where our care logistics folks will actually make an appointment for our member with a primary care physician, either within our database of providers, of known friendly providers to Redirect Health in your location, or the customer's or member's provider. We have an open network, and we'll actually send that member into the location. We also make sure that they get the fair price and help them pay for that care. So we have a patient assistance program that helps our patients manage their costs. And then the last piece that this team works on is workers' compensation management, where we'll actually help members with workers' compensation as well as the employers manage those costs. So our care logistics team, again, these are things that are happening on the phone: proactive care, telehealth, case management, patient assistance, and workers' comp. All that really results in what we call our redirection rate. These numbers, I think, were from July. We took over 4,500 phone calls in July. We had an almost 80% redirection rate for our members, which means we were able to solve their problem right over the phone. About 12% went into a primary care business office. About 8.5% went into a chiro or rehab. And you can see specialists and hospitalization was very, very, very small. Let's talk about the next set of benefits of everyday care. So we've talked about the benefits that are available over the phone and kind of how the system works. We have a ton of benefits also on this program that have built specifically for members to receive unlimited, what we call routine care. So what's routine care? Primary care and injury office visits, chiropractic office visits, preventative adult visits as outlined by the ACA minimum essential coverage. So, your physicals, your mammograms, your colonoscopies, et cetera, preventative well child care, all labs through a national program with LabCorp, and then immunizations. All this care is delivered to the member, unlimited in nature, any doctor, open network, $0 copay, no deductible, with one number to call. Okay? We have made this program specific to make sure that we've removed all barriers to our members and employees to receive care. The next question that typically is asked, well, what about non-routine care? What about if they go to the hospital, or what if they need an x-ray, or what if they have to see a specialist, et cetera, et cetera? While these are not covered benefits by the plan per se, they are covered by our care logistics care and logistical support. So we follow three fundamental core guiding principles. One, we want to make sure our members receive care. Two, we want to make sure our members receive the fair price for that care. For example, an x-ray does not cost $800, even though hospitals want to sell it to you for $800. It costs $50 across the street at the imaging center. And then the last piece is we want to help members pay for that care as well. There's 100 different ways to pay for health care. Insurance is one of those ways. The cash works, credit cards work, government assistance programs work like Medicare. There's lots of different ways to manufacturers programs through an RX program, et cetera, et cetera. So our non-routine care on the everyday care product includes those three items. And again, we want to make sure that the members receive the fair price and then help them pay for it. This plan does have a prescription drug program. Obviously, all of the MEC covered preventative medications, so the baby aspirin, the contraceptives, the non-smoking, et cetera, are all covered at $0 copay. And then we have a very, very comprehensive discount program that we work with the member to receive the drugs that they have been prescribed. Sometimes those are monthly maintenance type meds, and we use all sorts of strategies to help with that. Acute type drugs like antibiotic for a cold or one of those things. We shop about 5 or 6 different discount programs, find the best location with the best price, and then send the member into that location. Okay? Again, a quick follow-up on non-routine care. We always follow the 3 steps. Ensure the member receives high-quality care, get the member the fair price, and of course help the member pay for that non-routine care. We've also built with our partner Chubb a fixed indemnity buy-up option. This again helps for those members that want to continue to explore and maybe need a little bit more insurance for non-routine care. So we've built a sickness-only, critical illness, accident, and AD&D buy-up to the everyday care product. You can see the benefits there and the daily payouts, $2,000 and $3,000 worth of AME with a $100 deductible. So a very mindful program. It's underwritten by Chubb. The benefits are all managed by Redirect Health Care Logistics team. It's guaranteed issue. There's no contribution requirements. It's consolidated billing. Again, a very mindful program. We even go and help the member file claims when they have any of these expenditures that are qualified for that event. We'll talk quickly about our workers' compensation management program. Again, for the industries that we serve, they typically have pretty high workers' comp probabilities. We have successfully lowered EMOD scores for lots of businesses all around the country and literally put millions of dollars to their bottom line. There's 3 parts to the program. There's a passive piece. So we know, and I kind of explained a little earlier, that just by having health insurance and access to health care dramatically drops workers' comp claims. For example, I'm hanging Christmas lights on a Sunday and I hurt my back. I don't have access to health care. Guess what? Monday morning, somehow I hurt my back at work, and now I'm using the company workers' comp program as my personal health insurance. We also have employer-directed first aid. In most states, an employer can provide first aid to its employees without the need of filing a workers' comp claim. You need to check into your local, or your state, laws regarding workers' comp, but everyday care does include injury office visits. So if a primary care doctor is able to provide stitches or provide care for an instance, we're able to provide that to the member at $0 copay, 0 deductible. We have a drywall company here in the Southwest. They have over 800 employees. All of their foremen are issued our 800 number and instructed, assuming it's not life-threatening, to call us first regarding any injuries on the job site, and we instantly step in and help that employee receive care and hopefully save them a ton of money. The last piece is true workers' comp management. We're a provider in the food chain. So as a provider, we can do all sorts of things to help manage the cost. When a case does come workers' comp or become workers' comp, we're able to help manage a lot of those costs. And ultimately, instead of having $30,000 claim, maybe mitigate that to a $3,000 or $4,000 claim. We see this as a huge benefit to customers and something that no other health insurance company or health plan is talking about. Can give you a huge advantage when presenting to a potential client. So a little recap on everyday care. It's super easy. We talk about it's 61 cents per hour per employee, which is extremely affordable. We've actually done some case studies over the years, and even most recently with some janitorial companies, with some franchises in the food service industry, where when they've advertised free health care associated with a job placement, it gets significantly more attention and applicants when no health care is involved. So we actually did a case study recently with a janitorial company. It was $11 an hour is what they paid. So we ran ads at $11 an hour, and then we ran ads at $10 an hour with free health care. We had about 1,000 times more response, and we sent them over 300 candidates in 72 hours. The irony is they're paying less dollars, but the health care only cost them 61 cents. So they actually would make money on this deal or save money when they hired someone at $10 an hour as opposed to at 11 with free health care. No out-of-pocket, first dollar benefits, member assistance programs. There's really nothing on the market that we've found comparable in the marketplace with everyday care. I know we're running short on time. I'll quickly go through our premium plans, which is a high performance level funded major medical that includes everyday care. This is super easy and affordable small group self-funding. It includes everyday care, first dollar benefits, $0 copay, no deductible. Our care logistics delivers excellent customer service and a member experience. It's highly managed to ensure a fair price, lowers claim costs. We use an open network or reference-based pricing to achieve significant savings for our member and pay near Medicare rates for both specialists as well as facilities. We have 2 contracts that are available on our small group self-funding. One's called a performance guarantee. That actually gives the employer the option to self-fund at expected. Redirect Health actually takes the risk on the corridor to max, and then obviously the stop loss would kick in after that. And then we also have what's called a shared savings program, which again the employer would fund at max, and then ultimately they would receive a surplus return at the end of the 12-18 contract. This book of business is currently running about 44% of expected claims. The benefit design is very mindful. If you can see the screen here, obviously our strategy is to give away the inexpensive care for free, hence the no deductibles, no copays on the primary care. All the benefits are accessed through that 888 line, so we get the first crack in helping the customer and guiding them. A lot of telehealth products out there, they get excited about 10% participation on one of their plans. We have 100% engagement because our plan documents literally stipulate you need to call the number to receive benefits. Premium facts, ideal for groups in that 10 to 200 life space. It's level funded with a spec and an ag. Our stop loss carrier is Fidelity Security. It's medically underwritten 10 to 15 lives with health statements. So it's 51 to some claims history of 2 years. 75% participation, valid waivers, a 50% minimum contribution. Everyday care can be used to fulfill participation. Again, we service a workforce and specific industries quite well. If you had a group of 100 lives in a franchise Subway shop or something, you're going to have like 12 managers that want to do a major medical and the rest aren't going to participate. So everyday care can count towards participation on that group and ultimately help get you across the finish line. We've also instituted a new group RX query process. So for those groups in that 15 to 150 life space that aren't looking to do the medical questions, there's some stipulations there, but it's, for brokers, they're pretty excited about that option as well. Reference pricing, I'd be happy to go into a little bit more detail on that, but we've had great success in this realm. We approach it a little bit differently. The first question the broker asks is, well, what about balanced billing? Well, because all the benefits run through our care logistics team, we're getting the transparent fair price up front, so everybody's on the same page. That's fundamentally different than any other plan out there that I'm aware of. Even on specialists, even just a specialist visit to, a cardiologist, we're making sure we get the fair price up front. We do, however, based pricing vendor, and then we have billing take product from the Fiat group. Never even get into that because, again, we get the fair price up front, which is just a whole different process the other reference-based pricing out there. You can see in California, y'all are paying like 364% of Medicare. I was surprised. Arizona's worse, where I'm at, 443% of Medicare across the board. So that good deal that Blue Cross Blue Shield, the United Healthcare is bringing to the table, isn't that actually that good of a deal? The real kicker is those folks in Texas, gosh, they're just obliterated with almost 1,000% of Medicare across the board when you look at what the networks are charging in that location. This is kind of our trends. You can see we're totally bending the curve with regards to healthcare and our own costs over time. So if you look in 2016, we spent just under $1,700 per employee. The national average is about $6,500. So these are our own internal healthcare costs that we've just been able to bend the curve because of using our system and our benefit design and our care logistics team to manage and control care. This is kind of the strategy that we see works extremely well. You have dollar figures on the bottom of the people within the group, and then you have care along the left side there. Everyday care, fixed indemnity, solution of your choice, or our Everyday Care Choice and Choice Plus product. You have a major medical, obviously, in the upper right-hand corner. Out of pocket, that's your deductible. And then patient assistance programs blanket in the other, right? If you're making $10 an hour, you're really not worried about a $2,000 bill versus a $200,000 bill, which is a $2 million bill. You can't afford any of it. So patient assistance programs and those types of things really come into play. And in fact, we believe if you're making $10 an hour and you present an insurance card with like a $6,000 deductible, you're actually worse off than if you were to just be able to say, hey, I'll have insurance, and obviously a public assistance program is going to step in and we help that process along. Some common benefit designs that we see, again, taking advantage of that participation process. Hey, we have a complete redirect health solution. Everyday care, a fixed indemnity, our premium plan. This is ideal for low participation, new folks to self-funding, 150 lives healthy, and of course, because we have an open network, multi-state capability. We do work with a lot of large self-funded groups in the 10 to 15, 20,000 range. Keep those plans in place. Don't move the stop loss. Don't move the TPA. Just layer in everyday care for those folks that are not participating on the current self-funded plan, and then offer them a buy-up to a fixed indemnity. And then obviously there's those groups that just aren't eligible or a good candidate for self-funding. They're fully insured. Great. Keep the people, keep that UHC, that Blue Cross Blue Shield plan in place, and then layer in the everyday care product. What we found, I kind of follow the 300% rule, all the plans, all the customers, all the time. And when you layer in that everyday care product that's super affordable, it's amazing what type of participation bumps you will see within your groups. We're getting to the end, so super close. There's lots of easy enrollment options. We integrate with pretty much anything on the market today. Paper is always an option, but that's kind of the hard way. Some commission structure, very mindful and very competitive in the marketplace. We do have some brokers that offer some technology and enrollment solutions, and those need to be paid for. Hey, it's okay to bump those up a little bit to help pay for some of your fixed costs. Here's an actual case of a broker in Dallas, Texas, 50 life case, 30 people participating in a major medical, 20 people opting out. There's the commission made on that. By just getting 15 folks more on the everyday care plan, this broker was able to increase his commissions by 23%. That's just one small group, right? You can imagine what could happen with We have tons of support materials that are available through the general agency, marketing materials, sales materials, videos, and trainings. We want to be very mindful, helping you not only sell the product to the employer, but also sell it to the enrollment folks, and then follow up with member experience. Contract takes 5 minutes, and we can get you contracted in 48 hours. I have today, if you'd like to get some more information, please call Dave and his team there. There's his phone number. We're super excited about our relationship in Northern California. Again, we're here to support you. If there's any questions, please unmute your mic and we can talk about it here as a group.
Well, David, thanks so much for taking the time to introduce us to this. I greatly appreciate it, and I think this is a fantastic option going forward in this fourth quarter. We're still seeing a lot of employers struggling with the mandate and trying to attempt to follow the requirements to offer everybody coverage. So we have a lot more marketing to do of this among brokers and
Absolutely.
employers.
Dave, one of the things that I'll point out, and you hit on a really important piece. So we've obviously heard from brokers and agents in the market, and their clients are kind of squirmish, like, do I have to comply? Do I have to do this? What's going to happen with mandates? Blah, blah, blah. And I said, here's what we think about that. We don't know what the future is of ACA and mandates, but here's what we do know. Healthcare, getting affordable healthcare is never going to go out of style. It's never going to be regulated. It's never going to be in short supply or change with a tweet here or an executive order there or some crazy law in Congress. So if you have current MEC business today, that could go away tomorrow with a law. So what we believe and where we see a huge amount of success, especially with those brokers and agents with a large block of mech business, hey, go swap that out for healthcare. And what Everyday Care does is it gives you, while it does comply with the law today, it makes sure that those members receive healthcare. This isn't just preventative medicine, right? This isn't just your yearly physical for $50 a month. This is comprehensive, than 90% of healthcare today, and that is powerful. So we pitch this. If you pitch Everyday Care as a compliance play, you might as well just sell them a $50 MEC plan. But if you pitch this as access for your employees to receive the 90% of healthcare, it is a winner. If you pitch this as a way to improve retention, improve recruitment, lower your workers' comp costs, you're bringing a product to somebody that no other broker is going to bring to them, because no one's talking about that. I don't know a healthcare plan out there that even talks about workers' comp or employee retention or 90% of healthcare to their employees. So you have a huge advantage when you talk about healthcare as opposed to talking about compliance. So great follow-up, Dave. I really appreciate that.
Yeah, David, one of the things that I want to do is have a follow-up with you one-on-one after this call to talk about a network that we're using or trying to use here in Central California to assist with the agricultural groups that we have. We have probably 250 farm labor contractors or growers that are offering, minimum essential or minimum value coverage to their employees. And I want to have a discussion with you about a partnership with some of these nonprofit local clinics that are being set up, that have been set up as kind of a, if you would, a special network arrangement. So you and I can follow up on that together later.
Absolutely. And we have some similar arrangements already in some parts of the country. And there's many things that we can do. Again, because the benefits and the access to the plan is hitting us first, there's lots of opportunities to direct those members into the right and fair location. So again, spot on with your thinking there. As you look at our plans and the capabilities that we have, especially on our major medical side, there's a lot of opportunity to help people make good decisions. Our premise is we don't want to educate anybody to be a good healthcare consumer. We tried that with our own folks. We failed. We failed at educating our own people to be good healthcare consumers. The system is designed to screw the end user. So for us, we just do it for people, and that's the secret sauce that we found within our own organization, and what we find works really well with employer groups. You don't have to be an expert. All you need to learn is to dial the phone number, and then we just take it from there.
All right, well, we're going to need to sign off. Are there any other quick questions that from anyone? I'm mindful of everybody's time, so we're going to go ahead and sign off if there are no other questions. And appreciate that very much. And everybody, thanks for attending. And again, if you have follow-up issues, you can call myself or David directly, and we're happy to chat. All right? Take care, everybody, and have a great day.
Thank you, everybody. Thank you.